Hello, I'm Dr. Arun Warrier, consultant medical oncologist at Astra Medcity, Cochin. Today I would like to talk to you about head and neck cancers. So head and neck cancers rank the topmost among all the cancers in the incidence. The main reason for head and neck cancers is the use of tobacco. So this is the most sad part also, that we are having an eminently preventable cancer which is ranked as the topmost cancer in incidence. So head and neck cancers affects predominantly males because the tobacco chewing habits is highest among them. So one other factor which we have noticed recently is the number of young patients who come to us with these cancers. So the main reason when we talk about the history is that they use these unrefined tobacco products. So they chew these products and there will be high concentration of these products inside the oral cavity. So in a short period of time, they get cancerous growths, and we have seen that they are very aggressive tumors. So when we biopsy them, most of them will come back as squamous cell carcinomas, and most of them will come at a very advanced stage also. For some reason, they don't have pain initially, and only at an T4 or a very aggressive stage only, they come to meet the doctors. So they will have difficulty in opening the mouth, or there may be huge ulcers which may be bleeding, which are all warning signs of cancer. So the diagnosis of this can be confirmed with a biopsy test, which will tell us what is the type of cancer. So as I told before, it is squamous cell carcinomas which are most common. This will be followed with a imaging. Mostly it will be a CT scan or an MRI of the head and neck, which will tell us what is the extent of the disease, how much it has involved the nearby nodes, and if there is any involvement of the muscles and bones. All will be clear with this MRI test. And if there is any doubt of any distant spread, we may ask for a PET CT scan also. So this will be followed by a multidisciplinary meeting of the surgeon, the radiation, and the medical oncologist. So we will be speaking with the patient about the possible outcomes of treatment. And it is the surgeon who will be the captain of the team in most of these early head and neck cancers. So one fact is that the surgeries which are involved in head and neck tumors are quite extensive surgeries, because unless we remove the whole cancer or the whole tumor, then the cure may not be possible. So we have to properly educate the patient and the family about the implications of treatment, that they may lose a large area which can be reconstructed also, but they have to go through steps of series of surgical procedures in also may be needed in some cases. So we have to take them into full confidence, and we have to prepare them for a long battle with the cancer, because it's very important that we do proper surgery, and compromise in surgery is not feasible. And after the surgery is done, if there is an involvement of the nodes or if it's an extensive disease, we may follow it up with radiation and chemotherapy. So radiation is given on a daily basis for almost 6 weeks time, and chemo will be given on a once in weekly or 3 weekly basis. So once it is cured, again we have to follow up these patients for maybe 2 to 5 years time. As most of them have exposure to tobacco, there's a high chance that they may get second cancers in other parts. So we have to educate them to come back to us if there are any warning signs. And again, some of them may recur, and it may come in a stage 4 as a stage 4 cancer. Here there are options of immunotherapy, which is an upcoming modality in head and neck cancers, and we have seen in some people dramatic responses to immunotherapy, and responses to chemotherapy, and also targeted therapies like cetuximab, which are used in head and neck cancers. So all this has to be discussed in detail with the patient, and we have to think about palliative care also, which is a very important aspect in recurrent head and neck cancers, because many of them will have bleeding or pain as their main issue. With all this, we will be able to give them a good control of symptoms also. So just to recap, the head and neck cancers are eminently preventable, because if we avoid tobacco itself, we can prevent these cancers from developing. If you are having doubts like any ulcers which are not healing, any bleeding, any pain, then you have to consult a doctor who will do a biopsy and confirm. Then it will be followed by scans and a multidisciplinary discussion with all the doctors, oncologists who are involved in the care of cancer. So with all this, we will be able to cure the cancer and to help patients lead a symptom-free life. Thank you.